Yes, in the video, I can see a 5 months old child with paroxysmal cough with inspiratory stridor associated with facial congestion and cyanosis, and patient is connected to NG tube and oxygen. He is in hospital settings.
Okay. So what is your diagnosis and differential diagnosis?
Yes, mostly diagnosis is pertussis, and differential diagnosis is pneumonia, bronchiolitis, croup.
Yes. So it is a whooping cough, whoop like cough, coughing, coughing, child is coughing, vomiting. So it is a pertussis or whooping cough or pertussis like illness, bronchiolitis, foreign body, pneumonia, gastroesophageal reflux disease, aspirations, upper respiratory tract infection, COVID, multiple trigger wheeze, viral induced wheeze, underlying any lung disease like cystic fibrosis. So suppose whooping cough, what are the history we ask?
History is onset, course, and the duration, aggravating factor, relieving factor, and the characteristics of the cough. Is there associated any fever, redness of the eye, any blood in the any blood in the eye, bleeding from the nose, and family history of such illness, and the vaccination history.
Yes, we are asking onset course and duration, what increase or what decrease. Fever, weight, appetite, activity, sleep. FWSL easily. Then cyanosis, any apnea, pallor, choking, drooling, missing any toy. Post-to-ship vomiting, any aspiration after feeding. Vaccination history, especially DPT, and how many doses. Plus vaccination of the other family members. Any conjunctival hemorrhage, rectal prolapse, fits, any neurological signs. Parental history like regarding gestational age, term or preterm, any history of ventilations, and chronic illness, especially CP. What examination we do?
Yes, general general well-being, vital
Exact.
sign including
Mm,
the SpO2 and respiratory
mm,
system examination, and examination for the complication rate, eye, rectal prolapse, hernial orifice.
good. ABC vitals, oxygen saturation, measurement and plot on centiles, chest and cardiac examinations, anterior fontanelle for increased intracranial pressure or dehydrations, abdominal examination for hernia or rectal prolapse, eye examination for conjunctival hemorrhage. What investigation we do?
Yes, culture of the paranasal swab, nasopharyngeal spirit,
Mm,
and if you can, we can, if the child is severely ill, so we can do the PCR.
yes. So any child with cough equal more than or equal 14 days without any cause plus suspected case, one or more of paroxysm, post-to-ship vomiting, inspiratory hook. We do the paranasal swab for pertussis, that is PCR for Bordetella pertussis. The organism responsible is Bordetella pertussis. They can be asked. The serology, pertussis immunoglobulin G, CBC we can do, show lymphocytosis and leukocytosis, X-ray to exclude the other causes. And how can we manage this? Treatment what we give?
Yes, there is supportive treatment and specific treatment. A specific treatment is azithromycin for 5 days or erythromycin for 14 days.
Yes. 5 days, not 7 days. Yes,
7 days.
azithromycin 5 days. Okay, I'm telling management, fast airway breathing circulation, admit the patient, isolation, notification, rest, avoid pregnant women. So isolation, notification, very important here. Then antibiotics we are giving, that is less than 1 month, azithromycin for 5 days, more than 1 month, that is clarithromycin 7 days or erythromycin 2 weeks. And post-exposure prophylaxis with same antibiotics, treatment of time therapy. Who are post-exposure prophylaxis? These are close contact, pregnant women, health worker, immunocompromised patient. These are. And how can we prevent this? What vaccination we give?
We can prevent this by active vaccination, and also by the isolation of the patient, and prophylaxis for the close contact, and for
Yes.
the vaccination. Yes.
DPT vaccinations and isolations and avoid the close contact persons. These are especially the pregnant women, immunocompromised patient, and these are advice what we give.
Advice for the this cuff is 100 days cuff, so it can be, this cuff is can be remained, and we will after treatment we will look for the, if the it may be persist and can cause chronic cough
Advise
in
the
the.
mother regarding the nature of the disease, mode of transmissions, need for isolations, be away from the risk group, complications of the disease, apnea, signs of increased intracranial pressure. What is the isolation duration of pertussis?
Yes,
2 days
isolation during.
after starting antibiotic and 3 weeks if not starting antibiotic. Okay. So if we start antibiotic 2 day isolations and 3 weeks if not start antibiotic, what are the complication occur?
Yes, complications are the respiratory complications is the pneumonia, bronchiolitis obliterans, pulmonary collapse, pulmonary hypertension, otitis media, apnea, sudden infant death, and rectal prolapse, hernial orifice opening, subconjunctival hemorrhage, and CNS encephalopathy seizure.
Yes, yes. So most truly well recovery, but the illness is distressing. Pneumonia, bronchiectasis, pneumothorax, encephalitis, conjunctival hemorrhage, hernia, and rectal prolapse. What are the stages of illness in pertussis?
Yes, stages at the early stage, cataract stage, and convalescent stage. Early stage, there is fever, sore throat, running nose, and cataract stage, there is whooping cough, but and in the convalescent stage, cough may be present.
That is 3 stages: catarrhal stages, paroxysmal stages, and convalescent stage. So catarrhal phase only mild, cold-like symptoms. Paroxysmal stage, that is our patient, episode of cough with whoop. And convalescent stage, the cough episode become less. So this is all about pertussis. Thank you very much for your participations.